What role do temperament and personality play in eating disorders? Imagine your mind as a map guiding your actions and feelings every day. Sometimes, the way this map is drawn can influence how you handle stress, emotions, and even your eating habits. That's where temperament and personality come into play when it comes to eating disorders. These psychological factors shape how someone reacts to life's challenges and can make them more vulnerable or resilient to developing disordered eating patterns. Temperament refers to the natural way your emotions and behaviors are wired from birth. For example, some people are naturally more anxious or sensitive, which can increase their risk of developing eating issues. A person with a depressive temperament might often feel low or negative, making them more prone to using food as a way to cope. On the other hand, someone with an obsessive temperament prefers order and routines. While this can be helpful in some areas, it might lead to rigid dieting or perfectionism, which are common in eating disorders. Personality traits are the enduring patterns of how you think, feel, and behave. Traits like perfectionism, impulsivity, harm avoidance, and negative emotionality are often linked to eating disorders. Perfectionism is especially common in individuals with anorexia nervosa and bulimia nervosa. They set very high standards for themselves, obsessing over their weight and body shape, and often try to control these areas through strict dieting or excessive exercise. Impulsivity, which means acting without thinking, is more often seen in bulimia nervosa and binge eating disorder. It can lead to impulsive binge episodes or purging behaviors. Harm avoidance is another trait that plays a role. People high in harm avoidance tend to be anxious and cautious, which can make emotional eating more likely as a way to soothe their worries. Research shows that individuals with bulimia nervosa often score higher on stress sensitivity and negative feelings. Those with binge eating disorder tend to experience less positive emotions and more anxiety, even when depression isn't present. These traits can make someone more vulnerable to developing disordered eating habits. Understanding how temperament and personality influence eating disorders helps in creating better treatment plans. For example, therapy can focus on reducing perfectionist thinking or developing healthier ways to manage impulsive urges. Knowing a person's temperament can also help predict their risk and tailor prevention efforts. Recognizing these traits allows clinicians to address underlying emotional patterns that contribute to disordered eating, making recovery more achievable. In short, temperament and personality are like the blueprint of how someone interacts with their world. When these traits lean toward anxiety, perfectionism, or impulsivity, they can increase the chances of developing eating disorders. By paying attention to these psychological factors, we can better understand, prevent, and treat these complex conditions.